Think back to the last time you went to see your doctor. You probably sat in the waiting room, got called in, answered a few questions, had your heart and lungs checked, and then the doctor glanced at your test results and said everything looks fine. And you walked out feeling reassured. But what I am about to tell you today might change the way you see that entire process. In 2023, a major study published in the journal Nature Medicine found that an AI system detected breast cancer in patients that 2 trained radiologists had missed. Not one case, not 2 cases, but dozens of confirmed cases, all verified afterward as real. And what made it even more alarming was that those patients had been carrying a growing tumor inside their bodies without any idea. This is not science fiction. This is happening right now, in hospitals across the United States. And if you are 55, 60, or 70 years old, this is information you cannot afford to ignore, because with diseases like cancer, stroke, and heart disease, the moment of detection can be the difference between life and death. Today we are going to talk about how AI actually works in early disease detection, what it is capable of doing that even the best doctors struggle to do with the naked eye, and more importantly, what that means for your health right now. AI sees what the human eye cannot. Most people assume that a great doctor is simply the most experienced one in the room. That is not wrong. But there is a ceiling that humans cannot break through, no matter how many years they have studied or how long they have been practicing. When a radiologist looks at a lung scan, they are relying on what their eyes can see and what their brain has stored from thousands of previous cases. But AI does not have that same limitation. A single AI system can be trained on more than 1 million medical images, learning to recognize microscopic changes at a level that the human eye simply cannot distinguish. A faint spot smaller than a grain of rice on a CT scan. A barely noticeable shift in heart rhythm lasting just a few seconds. These are the kinds of signals that, if missed, can develop into serious disease within 6 to 18 months. This is not about saying your doctor is being careless. That is not the point. Doctors are doing the best they possibly can with the time and tools available to them. But a standard office visit lasts somewhere around 15 to 18 minutes. And in that window, no one can analyze hundreds of data points simultaneously, the way a system built specifically for that purpose can. And here is something even more important that I want you to hold on to. AI is not just looking at a single image. It is looking at your entire health history, from test results going back several years, to tiny shifts in your numbers over time. Things that you and your doctor might not notice because they still fall within the quote-unquote normal range. When normal does not mean safe. Here is a situation that many people your age have experienced. You go in for a routine blood test. Your doctor looks it over and says your results are normal, nothing to worry about. You go home. You feel fine. But in traditional medicine, the word normal usually means your number falls within a general reference range built for the average population. It does not mean that number is ideal for your specific body. And it definitely does not tell you what trend is unfolding inside you over time. For example, if your blood sugar has been slowly climbing from 92 to 98 to 104 over the past 3 years, each result still technically within the normal range, that trend is pointing in a very clear direction. An AI system is built to track exactly this. It does not look at a single data point. It looks at the full trajectory of your health, and it can flag a warning before you ever reach a dangerous threshold. A study from Google Health in 2022 demonstrated that their AI system could predict the risk of heart disease simply by scanning the back of the eye, faster and more accurately than traditional methods. That sounds hard to believe, but it has been clinically validated. And that brings us to something even more important that most people have never heard about. 3 diseases AI is catching earliest. Of all the ways AI is being used in medicine today, there are 3 areas where this technology is making the biggest real-world difference, especially for people between the ages of 55 and 70. The first is cancer, not just breast cancer or lung cancer. AI has been shown to detect colon cancer, pancreatic cancer, and even certain forms of blood cancer at very early stages, the kinds that carry an extremely high mortality rate when caught late. When pancreatic cancer is found at a late stage, the 5-year survival rate is around 3%. But when caught early, that number can climb above 40%. That is the kind of difference AI is starting to make. The second is heart disease and stroke risk. What makes this particularly alarming is that roughly 80% of heart attacks show no clear warning signs beforehand, especially in women. Many people just feel slightly tired, a little short of breath, or notice a mild ache in the shoulder they assume is a muscle strain. AI can analyze an electrocardiogram and detect small abnormalities that even a seasoned cardiologist might overlook when reading by eye alone. At Mayo Clinic, they have been using AI to predict dangerous irregular heart rhythms in patients whose electrocardiograms appeared completely normal. The third is cognitive decline and Alzheimer's disease. This is the one that many older adults worry about most but tend to get screened for the least. AI is being developed to detect extremely subtle changes in a person's speech patterns, word choice, and memory responses, signals that can appear 10 to 15 years before the obvious symptoms of Alzheimer's disease begin to show up. If you are reading this and wondering what you are supposed to do with all of this information, the answer matters more than you might think. Why your age is the most important window. There is something I need to say directly because this video is about your health and I am not here to paint everything in a perfect light. Starting around age 55, the body begins accumulating changes that were not present years before. And what makes that so concerning is that most of those changes happen quietly, without pain, without symptoms, right up until the point where they no longer stay quiet. According to data from the Centers for Disease Control and Prevention, roughly 6 out of 10 American adults are living with at least one chronic disease, and the majority of those conditions are diagnosed later than the point where treatment works best, not because people are avoiding the doctor, but because traditional medicine can only detect what has already grown large enough to see. AI is changing that, and what I want you to understand is that this is not some distant future. Major medical centers across the United States, including Mayo Clinic, Cleveland Clinic, and Johns Hopkins, are already deploying AI tools inside their real clinical workflows. Some personal health apps are beginning to integrate these features as well, and this trend is only going to accelerate in the years ahead. That means if you have been waiting to ask your doctor about more advanced screening options, now is the right time to start that conversation. Not next year, not when symptoms appear, right now. The side of this story no one tells you. I want to be honest with you about something, because I am not here to give you a version of this that leaves out the complicated parts. AI in medicine is not perfect. It can produce false positives, meaning it flags a potential disease where none actually exists. That can lead to unnecessary follow-up testing, anxiety, and sometimes real financial cost. That is a challenge the medical field is actively working to address and improve. But here is the more important perspective. Human error in diagnosis is also very real. And in many cases, a false positive that leads to additional testing is still far better than missing a growing tumor because a doctor did not have the time or the tools to catch it. The point is not that AI replaces doctors. The point is that AI and doctors working together produce better outcomes for patients. And when that happens the right way, the person who benefits most is you. That brings me to the final part of today's video, which I think is the part you actually need to hear. Final words from Dr. Angelina. If there is one thing I want you to take away from this video, it is this. Your health is not something you should only think about when your body starts sending alarm signals. The most dangerous diseases do not arrive with a clear warning sign. They grow quietly for years, and by the time you feel that something is wrong, the window for early intervention has already narrowed significantly. The good news is that you still have time. In fact, you are at exactly the age where proactive screening delivers the greatest impact, not because something is already wrong, but because this is the stage of life where your body still has a strong capacity to respond and recover when a problem is caught early. Here are practical steps you can start right now. Ask your doctor about modern screening options that use AI-assisted image analysis, especially if you have not had a colonoscopy in the past 5 years, or a low-dose CT lung scan if you have a history of smoking. If you are monitoring your blood pressure or blood sugar at home, write the numbers down over time and bring that record to your next appointment, because that trend is far more valuable than any single reading. And if you have not had a comprehensive blood panel done this year, schedule one, not because you are sick, but because that is how you make sure you are not sick without knowing it. AI-powered medicine is advancing faster than at any other point in the history of healthcare, and that is a good thing for all of us. But the most advanced technology in the world cannot help you if you are not actively choosing to use it.